Hi, I'm Peter Allen, physiotherapist. Thanks for coming to this presentation. As we'll discuss today, for the past 2 years, I've been working with Professor Tony Goldschlager, neurosurgeon, Professor Scott Ayton, neuroscientist, Dr. Harshan J. Kumar, sleep physician, and others to develop an evidence-based, ancillary model of care that physiotherapists can use to consider improving sleep to improve pain for our chronic pain patients. We decided to focus on 2 key interventions. The first intervention was to screen for and treat concurrent sleep disorders.
Hi, my name's Claire. My physiotherapist is doing a physiotherapy trial. Generally, I'm sort of adapting my life to work around my lower back pain.
I think it's really important in any discussion of pain that we talk about sleep.
So if a person has chronic pain, there's a very clear bidirectional relationship between sleep and their pain, and it goes in both ways.
And sleep, as something to focus on to improve pain, can have a profound impact.
The evidence shows that patients with chronic pain are very likely to have a concurrent sleep disorder, such as insomnia and/or obstructive sleep apnea. And that when you treat sleep disorders in these patients, that quite independently of treating the site of the pain, treating the sleep disorder could in itself cause a significant reduction in pain.
One example was a study by Khalid et al. In sleep in 2011. So they did this study of people who have got obstructive sleep apnea and also chronic pain. And then they gave them CPAP therapy, and of course the OSA was improved very substantially. And they did this for a period of 6 months, and then they took away the CPAP. A really good addition to this study is that they also looked at the experience of pain during this period of time. And what they showed was that people who have got obstructive sleep apnea have got a very low tolerance for pain. Then they get treated for OSA, their sleep dramatically improves, and then all of a sudden, their tolerance of pain increases. Their experience of pain was less. And that just didn't happen initially. That was sustained, and it actually increased over a period of time. But you know what? The minute they stopped taking CPAP treatment, their pain tolerance worsened. Their experience of pain was worse. And so I think that was such a elegant example of how when you improve sleep quality, you actually reduce the experience of pain.
Physiotherapists like myself are not trained in taking sleep histories or screening for sleep disorders. So the first part of our intervention was to provide training and support to physiotherapists in order to be able to do this. I'm sorry to interrupt, but we're going to have to get started. We're on a pretty tight schedule this weekend. I'm going to stand here because they're actually recording, so I'm going to get everyone to just shuffle maybe over this way. Thank you. So thanks so much for your time this weekend. We really do feel it'll be incredibly valuable. We feel that you'll get a really good understanding about sleep and pain and how that knowledge will hopefully assist your clients in their long-term health outcomes.
Thanks everyone for coming. We've had a few of these talks now, and the questions that we get from physios are so insightful. Like, it's just a completely different world to what we experience in clinical sleep medicine. So it's really great, and feel free just to keep jumping in when I'm presenting today, and we'll try and make it as relevant as possible to what you're actually experiencing out there in the community. Just want to introduce what we've put together, which is the Physio Healthy Sleep Triage. So the Healthy Sleep Triage has been created to allow physios to quickly ascertain who needs a further assessment of their sleep for a possible disorder and who clearly has no issue with their sleep. How do we actually allow you to focus in and screen for a sleep disorder without it taking up the entire consult? Because that's my job. We run consults of 15 to 30 minutes purely on sleep. Obviously, you've got a lot more to get through in that amount of time. We're trying to ascertain whether the person identifies an issue with their sleep, whether or not pain is affecting their sleep, and then if they have any clear features of an underlying sleep disorder, such as sleep apnea by them snoring overnight, or whether they have issues with insomnia, such as waking up through the night and having difficulty getting to sleep, or having difficulty getting to sleep at the start of the night.
Beyond training in the Healthy Sleep Triage, physiotherapists were also given at-home sleep devices to give to their patients. These studies recorded information about the patient's sleep overnight, which could then be accessed by a sleep scientist and reported on by a sleep physician to consider whether the patient needed further investigation or treatment of an underlying sleep disorder for the purposes of seeing if it can reduce their pain.
Hi, I'm Wayne Johnston. I'm an ex-professional footballer from the Carlton Football Club. I played throughout the 70s, 80s and start of the 90s. Yes, I've had about 30 operations due to that process of playing football. And some of those have been with my spine, with some really nasty operations there. But I'm now looking forward to a good life after football. With the bed I'm in at the moment, and this is not digressing, but I've got 4 pillows in the bed, and sometimes when I wake up, they're all over the place. One's down near my foot. I think I must have had a fight in bed with them or something. I don't know, and it's quite unique. That's when I've had a bad night with my back. Now, I look back on those nights and I go, what did I do during the day? And I still couldn't put a finger on it.
Though there is research that shows how a patient sleeps on a bed is important, physiotherapists currently have no system to be able to prescribe the support a patient needs based on their unique musculoskeletal concerns. Basically, they have no way of knowing how the patient is supported when they sleep at night, nor do they have any control over adjusting it. And so, when you look at what these patients have been lying on, when you look at the posture that the body is in, when they're lying on these beds, what's happening to their lower backs, their shoulders, their necks, it really is completely random and quite eye-opening. And so it's common for physiotherapists to have patients who have had chronic pain for years, who have had multiple interventions, been on prescription painkillers, been through the works, but no one knows what they're sleeping on, and no one has ever had any control over their bed. That's why the second intervention we pursued was giving the physiotherapists reliable control over the patient's sleep support at night. Building on research performed elsewhere, we designed a fully adjustable, unique bed system with the help of engineers that allows a physiotherapist to be able to visually assess a patient's posture in bed using a video reference monitor. The physiotherapist adjusts the body's posture in 10 body zones on the mattress, each of which can be calibrated in 10 degrees of firmness on a specially designed fitting system that is housed in the physiotherapist's rooms. After fitting the body on the bed, the head and neck support are also fitted using an adjustable pillow system. The physiotherapist can then document the prescribed bed and pillow on script, which is then used to set up the exact bed in the patient's house. As the mattress is placed on a steel reference frame, both on the fitting system and on the bed provided in the patient's home, the bed setup at home exactly matches the bed prescribed in the physiotherapist's office. The physiotherapist can also, in the future, make adjustments by simply refitting the patient and providing the replacement firmness pads to the patient. The model of care with these 2 interventions we have prototyped is completely novel. This is the first time that we are aware that physiotherapists have been trained to screen their patients with pain for sleep disorders and refer them for treatment. And this is the first time we are aware that a physiotherapist has been able to have precise control over the sleep posture and support a patient has in their bed at home. Undertaking this feasibility study was a huge endeavour. In terms of the results, the feasibility study gave us the opportunity to run into a lot of hurdles and fix them one by one as we went. And in the end, physiotherapists have been very happy with their model's design and have found it practical to implement in their clinics. Thanks again for coming to the presentation. Let's now take some of your questions. Let's talk a bit about the results of our feasibility trial. The research already shows that improving sleep can make a significant impact to pain. Our work was to put that in place by creating a practical model of care for physiotherapy practice. That work has been successful, and we plan to expand it into a number of pilot clinics. Quantitative research is needed to examine the outcomes that can be achieved by incorporating this model of care by physiotherapy clinics. And we are currently coming together to collaborate on a randomized control trial. However, we are pleased to report that the 6 patients with chronic pain that have participated in our program so far have all had excellent results, above and beyond what they had achieved by standard of care physiotherapy practice alone.
So living with pain, it's like living with a shadow that follows you everywhere. We were travelling at full speed, high speed, along a country road, and a car came out in front of us. I ended up with sacroiliac joint dysfunction and lower back and neck pain. And then age kicks in and degeneration happens. So you're sort of always chasing your tail. That sent me on a search for a physiotherapist, yoga, meditation. 2 years ago, I had a neurostimulator implanted in my back. Recently, I just had a total knee replacement. You clutch at anything you can to return your back and your lifestyle to its reset position or its original, active ways. I would love to be able to just take a Panadol and have it fix a pain. That blows my mind too, that people can take a Panadol and it fixes it. My physiotherapist is integral to managing my ongoing chronic pain. But recently, my physiotherapist told me they were participating in a new program where they could work on my sleep. I actually had a lot of pain in bed. I was sleeping with up to 7 pillows. And it was the first time that had happened, that people had asked me about my sleep. We'd discussed, what my bed is like, how my sleep is. Do I wake up refreshed? Do I wake up in more pain? So around those discussions, realised that my sleep wasn't great. My physiotherapist performed an at-home sleep test to look for sleep disorders. So fitting me for my customised mattress, you're lying on your side, you're watching the screen, and if you imagine there's sort of a line from the base of your head to the tip of your tailbone, pain that I was getting in my hip or my shoulder tip, and adjusting the mattress in its firmness in those places to make room for my shoulder, to make room for my hip, to support me in my mid-spine. You can see why your shoulder isn't comfortable in that position. You can see why your hip isn't comfortable in that position. You can see why your mid-spine is not sitting nicely and comfortable, so it's any wonder that you're sort of waking up in discomfort because, your body's working against it all the time. I noticed the improvements with my pain literally after the first night. It was great. To wake up in the morning without that deep pain that you have in your shoulders or your hips, lower back. It's really quite refreshing, and to wake up refreshed and to not wake up during the night because you're not in pain. So that is just such a benefit. So my activity level in terms of on waking, I don't have to wait so long for my body to loosen up. So my family and friends have noticed that, I'm more enthusiastic about, taking on some of those activities because I'd sort of backed off a lot of those things because of pain in achieving those activities. Sad state of affairs at my house is a bit tidier and cleaner because it doesn't hurt to do those things. I can walk up to the shops, I have a brand new baby grandson. I can pick him up, hold him and nurse him without any effects. And that's just from being pain-free.
Claire's results from the programme are not isolated. Another participant, Wayne Johnston, experienced significant reductions in neck and back stiffness. And I think we've got the one here.
Oh, God, that's another world.
Excellent. So I think that's the pillow that we're going to go over.
Yep.
He's now able to walk 15 kilometres at a stretch and has returned to full-time work with renewed energy. Tim, a participant with long-standing, debilitating lower back pain at night from discogenic back pain, experienced complete resolution of his pain, while his partner, Nish, also experienced a significant improvement in her neck pain and cervicogenic headaches. In fact, all of the patients involved in the programme experienced a reduction in chronic pain, showing this model of care has vast potential. We hope that these results will be replicated in a randomised control trial. Physiotherapists now have a new holistic tool in the management of chronic pain, and we hope this will make a real difference to their patients.